So this is a normal red blood cell. They're donut shaped. And this is a sickle cell. They're like sickle shaped and look like a moon crescent. Shows how the sickle cells are clogged in the blood vessels. So the sickle cells are traveling in the bloodstream and then they get caught into tiny spaces in the blood vessels.
Hi, my name is Ariela and I'm in 11th grade. I'll be going to 12th grade in a couple of months. And I'm in high school and I'm in their medical program, thanks to God, which I really enjoy. And I also got 2 medical certifications a couple of months ago, thanks to God, the CMAA, the Certified Medical Administrative Assistant, and the Certified Electronic Health Specialist.
Hi, I'm Ismhael. I'm going to high school in some months, and in middle school I was in the medical program. And thanks to God, I'm going to the medical program too in high school. I like the medical program because I like learning about the medical field.
So today we're going to talk about the sickle cell disease, which is one of the medical topics we learn. And so this disease is caused when a person inherits 2 sickle hemoglobin genes, one from each parent. So this causes the red blood cells to become misshaped, like sickle-shaped, and rigid and sticky. So these characteristics that the red blood cell has causes them to clump together in the blood vessels, blocking the blood flow and causing many different health problems. And in addition, these red blood cells, which are sickle-shaped, they die prematurely. They have a much shorter lifespan than normal red blood cells.
So a healthy red blood cell lives 90 to 120 days, but a sickle cell only lives 10 to 20 days. So some symptoms of sickle cell disease are anemia. So anemia is caused because the sickle cells keep dying easily and very fast. So that means there's less oxygen carrying capacity in the body. So there's less red blood cells to carry oxygen, so that causes anemia. Another symptom of sickle cell disease is pain crisis. So pain crisis occurs when the sickle cells get stuck into the walls of the bloodstream, and especially in tiny blood vessels. So they get stuck, and that causes intense pain, and that pain can last up to days or even weeks. Another symptom of sickle cell is acute chest syndrome. So this is when the sickle cells stick together and block oxygen flow into the chest. So this causes chest pain, cough, fever, and low oxygen levels. Another symptom is splenic sequestration. This occurs when the sickle red blood cells get trapped in the spleen. So it makes the spleen get enlarged and also causes pain and swelling, fatigue, dizziness, and more. Another symptom is stroke. So the sickle red blood cells block oxygen into the brain.
So another symptom of the sickle cell disease is jaundice. So jaundice is when a person gets this yellow-orangey look on their whole body, especially their face. And it is because since the sickle red blood cells die too quickly, since they die prematurely, way too quicker than they can be filtered out by the liver. So since the red blood cells die way too quickly, they produce this liquid called bilirubin, which causes a yellow-orange look on a person's body. So now the diagnosis of the sickle cell disease. So this is usually diagnosed right at birth because all newborns are screened in the United States for the sickle cell trait and disease. For the trait, a person would have 1 normal hemoglobin gene and 1 sickle hemoglobin gene. So this wouldn't cause many complications. It usually doesn't cause any at all. But if they have the disease, the one we're explaining right now, then it would have all these symptoms and lead to many health problems. So right at birth, a newborn would know if they have the sickle cell disease. But in the case maybe that they were born in the United States or some other exception, they can get this blood test, which is called the hemoglobin electrophoresis, which is to test the type of hemoglobins they have in the red blood cells. So the treatment for the sickle cell disease is usually hydroxyurea, which is a medicine that is given for children as young as 9 months old to their whole lifespan. So this is to prevent the sickling of red blood cells. So instead of the red blood cells becoming sickle red blood cells, becoming misshaped, rigid, sticky, and all that, instead, it produces the red blood cells in a healthy way, as any person would.
Another treatment is called gene therapy. So gene therapy restores the hemoglobin's ability to capture oxygen and gives the sickle cells the normal shape. So it changes the shape of sickle cells to red blood cells, healthy red blood cells. So it changes the present sickle shape into a circle shape.
So thank you for watching the video. I hope you really liked it, and we also enjoyed making this video so much because we got to explain the disease and we really liked it so much, and I hope you did
Thank you for watching us and learning about sickle cell disease. Next time we're going to make a video about a different topic. Bye.
Bye.
I'm going to make some illustrations to make it easier to understand the sickle cell disease. So this is a normal red blood cell. They're donut shaped. And this is a sickle cell. They're like sickle shaped and look like a moon crescent. So this is the bloodstream. So this is a normal red blood cell. They're circle shaped, but they're few in the sickle cell person that has a sickle cell disease. So this is a sickle cell. So they clot easily into like tiny holes in the blood vessels. And this image shows how the sickle cells are clotted in the blood vessels. So the sickle cells are traveling in the bloodstream and then they get caught into tiny spaces in the blood vessels. So they get stuck here and doesn't let like the other cells pass through. And they keep clotting and keep making lumps of like cells, and that doesn't let the oxygen pass through. So that causes many symptoms like anemia.
Jeremiah 1:19. They will fight against you, but they will not win the battle over you. I am with you. I will save you, announces the Lord.